Hello, Ms. Smith. It's Kathleen, your CNA. The nurse asked me to come in and provide some catheter care for you. I'm going to get the equipment and we'll get started. First thing you want to do is make sure you provide privacy. You want to make sure you have the right equipment for this skill in providing catheter care. So you notice, of course, we have our basin of water, we have our gloves, we have our soap, washcloth, and 2 towels. So now we're ready to start the skill. Now with catheter care, you also want to make sure when you see the bullets going up and you see those critical steps in bold, there are 2 critical steps. So you want to make sure that you do those exactly as they're written. So please pay attention to that when I'm doing it, okay? Now, of course, we've already checked the water to make sure it's okay, but again on test day, anytime you're going to give care and you're dealing with water, if your patient is able to or not, you want to make sure that you try to see if they can verify the temperature. So on test day, you would just say, Ms. Smith, would you check this water to make sure it's okay? Just a reminder to let you know to do that, okay? Before you start your skill, you're going to put your gloves on. Again, befores are very important. We want to put our gloves on. Now, once we get our gloves on, one of the towels we're going to place up under her to utilize as a barrier so not to get her bed wet. You want to keep your patient covered up, maintaining that privacy. The first thing I want to do prior to putting that up under her is I'm going to just push her gown up out of the way, and you're going to be able to see me do catheter care in a moment, but you don't want to overexpose your patient until time. So you want to keep that in mind. So I'm going to take one of my towels, and what I'm going to do is just move this a little closer to me so I'm not reaching. I'm going to take one of the towels. I'm just going to leave it halfway, fold it, and I'm just going to place it up under her buttocks. Okay? And you'll see the placement in just a moment. But right now we have to maintain privacy. So you have to, of course, do this with your patient maintaining privacy. Okay? Relax this leg here. We can relax this one. I'm just going to make sure that the towel is up under her properly. Okay? Now, in order to provide this care, I have to expose the area that we're going to be washing. So I'm just going to bring the sheet down just to her perineal area so that you can see what we're doing. This is the catheter. Of course, you guys know that this is